you can expect a very good recovery from this form of cancer. The medical treatment nowadays is very advanced, and thankfully for breast cancer is one of the most well-researched fields, with the most advanced treatment, be it surgical or medication, and many times many of our patients do very well. So okay, down to the details for what kind of treatment can I expect for this. You will have heard of surgery, definitely. You would also have heard of other forms of treatment such as chemotherapy, radiotherapy, as well as hormonal therapy, which are tablets that some ladies take for this disease. So basically, what are all these? Okay, so we start with surgery. Surgery usually forms part and parcel of all kinds of treatment for breast cancer. So at some point in time, you will be needing surgery for your breast cancer. Sometimes the sequence in the sequence of treatment, it may be the first treatment that you start with, and other times it may be the second treatment that you start with. Surgery, there are many forms of surgery. Surgery can be limited either to remove the tumor and a clear margin of tissue. Sometimes when it's not suitable, we may have to remove the entire breast. Nowadays, it's possible to do reconstruction on the breast so that after removal of the breast, you can still maintain the shape of the breast. And this can be done at the same time as the surgery to remove the breast tumor. So that is surgery in short. What about things like chemotherapy? Will you be needing chemotherapy? It depends on a lot of things. In deciding whether or not lady needs chemotherapy, doctors often look at what the tumor is like. We look at the receptors of the tumor, such as the estrogen receptor, the progesterone receptor, and the HER2 receptor. We also look at how large the tumor is. We also want to know whether the lymph nodes are involved or not. So all these things will be taken into account. Sometimes we do tests that help us give an idea of whether chemotherapy will be beneficial for you. So all these factors have to be taken into account. As for radiation, again, it depends on all the factors that I mentioned for chemotherapy. On top of that, for radiotherapy, the choice of surgery that you decide on also plays a part. If a lady has decided to remove only the tumor and a rim of normal tissue around it, that kind of surgery is called a lumpectomy. It is also known as a white excision. So this surgery is always accompanied by radiotherapy after that. It may not be so for mastectomy. What's next? Hormonal therapy. Hormonal therapy are oral tablets that we take. Again, this depends whether or not in the very first place your tumor has the receptors, namely the estrogen and the progesterone receptors. So if these are present on your tumor, then usually at the tail end of your treatment, you will be offered hormonal therapy, and this is usually given for as long as 5 to 10 years. Yeah, so this is what you can expect from your treatment. The next common question we will get is, what is the sequence of the treatment like? How long is all this going to take? So often we do start with surgery first. If we start with surgery, the recovery time after the surgery can be anywhere between 2 to 4 weeks. Shortly after that, if chemotherapy is needed, then that comes next, and that usually lasts anywhere between 3 to 6 months. If radiotherapy is a part of the treatment, that comes after the chemotherapy, and that will be 3 to 4 weeks. And after the radiotherapy, we will start with the hormonal therapy. Occasionally, we may start with the chemotherapy first. That is very useful to eliminate small cancer cells that may be in other parts of the body that are microscopic and can't be seen on scans. In addition to that, chemotherapy that is done before the surgery has the added benefit of sometimes shrinking the tumor in the breast. So what may be an initially large tumor that is difficult to perform breast conservation for, sometimes after chemotherapy, the tumor may shrink markedly and it may be possible to do breast conservation. So there are times that we start with chemotherapy first, before the surgery, and then after the surgery, we continue with the rest of the treatment, such as radiation as well as hormonal therapy.